Coronary artery disease is a disease that affects the arteries that supply the heart. So the heart is an organ that pumps blood to the whole body, and there's separate arteries called coronary arteries that supply the heart itself with blood. You get plaque formation in some of these arteries, and that plaque formation is called coronary heart disease. Coronary artery disease is caused by plaque buildup in the wall of the artery. Initially, it's the low-density lipid lipoprotein that is taken up by the arterial wall. And there's two fates of the plaque that are in the walls of the arteries. Either they can keep growing and narrow the blood flow, so you'll get chest pain when you exercise and exert yourself, or you can actually have a rupture of that plaque and have a clot form, and that's called a heart attack. There's modifiable and non-modifiable. The ones you can't prevent are your genetic predisposition to the disease, your age, your gender. These are things that we unfortunately cannot change. But the modifiable risk factors we can, and that's number one is smoking. Number two is decreasing our intake of animal products, less meat, less cheeses, these types of things that are heavy in cholesterol. Lack of exercise is another bad player. If you're a diabetic and don't have good control, that really wreaks havoc in the coronary arteries. The symptoms of coronary artery disease are traditionally thought of as chest pains or chest pressures, particularly when you exercise or when you walk upstairs or when you walk uphill. Oftentimes people don't have those. Sometimes they'll just feel tired or short of breath when they're exercising. This is also quite true for women and elder patients where they don't have the traditional angina or chest pains. They sometimes have only neck pain or arm pains or some shortness of breath. So if you're a patient of the appropriate age, above 50, 55, and you have risk factors such as high blood pressure, high cholesterol, family history, or diabetes, and you start to not feel well, you should ask your doctor, could this be a manifestation of coronary artery disease? One way is to talk to the patient and see, do you get chest pains or pressures, particularly when you're exerting yourself? Do you get short of breath when you're exerting yourself? That's one way. Then we can do stress tests. We can do either on the treadmill or chemical stress test with or without nuclear help, which sort of lights up the whole heart. But if part of the heart does not light up, then you have a blockage there. And thirdly, you can do coronary angiography. This is an invasive procedure that traditionally has been using the leg as an access site to thread a catheter to the heart and take pictures. But now at Mother Frances Hospital, we have a new technology. This is called transradial catheterization. This is much more comfortable for the patient, and it's a catheter that goes in the wrist, and you can thread the catheter from the wrist. This is much more comfortable. Patients can get up right after their procedure, even if we put a stent in the heart. And oftentimes they go home that same day. Coronary artery disease is a disease of the entire blood vessels, and it's not only of the disease of the blood vessels in the heart, but in the arteries of the neck, of the leg, of the aorta in the body. So really the mainstay of treatment is medical therapy. That should be some sort of platelet inhibition with something like aspirin. And the mainstay now are the statin drugs. These are the Lipitors and the Crestors and the Zocors. And these do excellent things to our cholesterol. In addition, they actually help decrease the inflammation that's in the wall of the arteries. And they're the mainstay. Other things are some other medicines, and for patients that have severe chest pains, a lot of pressure in their chest, we can do coronary stenting, where if you have a few blockages, we put up a metal scaffold that opens up that artery. Or if you have too many blockages, you can have bypass surgery. We're very fortunate here at Mother Frances Hospital that the cardiologists and the heart surgeons are working very much together and sometimes doing hybrid procedures. So they'll get part of one artery will have a bypass and the other arteries may get stents. This is a high-tech new field that we're pioneering at our hospital. If you're diagnosed with coronary artery disease, this is obviously going to cause some degree of concern and stress and anxiety. But as long as you talk to your doctor, change those modifiable risk factors that we talked about, smoking, cholesterol, exercise, diabetes, and live a healthy lifestyle, we can really prolong our lives even with this disease. So all is not lost, and we can live a good and healthy life even with the disease. We can temper the disease.